Good afternoon. Welcome to the City Council joint meeting with the Minnehaha County Commissioners. The meeting will start in 60 seconds.
One nation under God, indivisible, with liberty and justice for all.
Good afternoon and welcome to the Minnehaha County Sioux Falls Council meeting on June 23rd, 2015. A roll call.
County Commissioners Barth.
Present.
Bender. Present. Benega. Heiberger.
Yes.
Kelly. Here. City Council members Anderson.
Here.
Erickson.
Here.
Erpenbach.
Here.
Jamison.
Here.
Karski.
Here.
Kiley. Rolfing. Staggers.
Present.
Uther.
Counted for and a quorum here. I look for a motion on the county side to approve the agenda.
So moved.
I have a motion and a second to approve the agenda. All those in favor say aye.
Aye.
Those opposed, same sign. Motion passes unanimously.
Motion to approve on the city side.
Council members Anderson.
Yes.
Erickson.
Yes.
Erpenbach.
Yes.
Jamison.
Yes.
Karski.
Yes.
Kiley. Rolfing. Staggers.
Yes.
Motion passes unanimously. Item number 1.
Item 1 is presentation of the National Association of Counties initiative by Wendy Giebink, Executive Director for NAMI South Dakota, and Phyllis Aaron, Chapter Administrator, NAMI South Dakota.
I raised 3 boys, so I don't often need these things. So if I holler too loud. Wendy Giebink is sitting over there, but because we only had 10 minutes, and we can both take up 10 minutes in a flash, I got delegated to do this. Thank you for having me. I'm Phyllis Aaron, Executive Director of NAMI Sioux Falls. I don't know how many of you have heard anything about the Stepping Up initiative, but I'm going to go through this as quickly as I can. There was a time when news of jails serving people, got to do the clicker thing. There was a time when news of jails serving more people with mental illnesses than inpatient treatment facilities in their county was shocking. Now, it's not surprising to hear that counties across the nation routinely provide services to the estimated 2 million people with serious mental illnesses booked into jails each year, or that prevalence rates of such serious mental illnesses in jails are 3 to 6 times higher than for the general population. Almost 3/4 of these adults have co-occurring substance use disorders. Once incarcerated, they tend to stay longer in jail, and upon release are at higher risk of recidivism than individuals without these disorders. The human toll of this problem and its cost to taxpayers is staggering. Jails spend 2 to 3 times more on adults with mental illnesses that require intervention compared to those without those needs. Yet often they cannot achieve recovery and recidivism reduction goals. Despite counties' tremendous efforts to address this problem, they are often thwarted by significant obstacles, including coordinating multiple systems, balancing political agendas, and operating with minimal resources. Consequently, large numbers of people with mental illnesses continue to cycle through the criminal justice system, often resulting in tragic outcomes for these individuals and their families, missed opportunities for linkage to treatment, inefficient use of funding, and failure to improve public safety. Recognizing the critical role local and state officials play in supporting change, the National Association of Counties and the Council of State Governments Justice Center will lead an unprecedented national initiative to help advance counties' efforts to reduce the number of adults with mental and co-occurring substance use disorders in jail. There are many innovative and evidence-based practices already being implemented across the country. To build on that strong foundation and bring these efforts to scale, NACO and the CSG Justice Center plan to engage partner organizations with expertise in the complex issues at stake, including those representing sheriffs, jail administrators, judges, community corrections professionals and treatment providers, consumers, advocates, mental health and drug abuse service directors, and other stakeholders. What distinguishes this initiative is the coordination of state and local leaders to bring about system changes based on data-driven strategies. And I'm just going to throw in my own little thing. It sort of reminds me about the process we went through to bring mobile crisis team to the Sioux Falls area. So I think we're going to, we've already got a step into how to bring everyone together. The initiative has 3 key components. The first, a call to action demonstrating strong county and state leadership and a shared commitment to a multi-step planning process that can achieve concrete results for jails in counties of all sizes. The call to action is more than a vague promise for reform. It focuses on developing actionable plan that can be used to achieve county and state system changes. As part of this call to action, county elected officials will work with other leaders, the sheriff, district attorney, state policymakers, people with mental illnesses and their advocates, and other stakeholders on the following 6 actions. First, convene and draw on a team of county leaders and decision makers from multiple agencies committed to reducing the number of people with mental illnesses in jail who do not pose a public safety risk. Second, obtain prevalence numbers and assess needs to better identify adults entering jails with mental illnesses and their risk for recidivism, and use that baseline information to guide decision making. And although there is a high prevalence of substance use disorders in jails, this initiative initially focuses on people with mental illnesses and those with mental illness and substance use disorders. Number 3, measure treatment and service capacity to determine which policies and programs and services are available to minimize contact or deeper involvement with the justice system for individuals with mental illnesses. Fourth, make a plan with measurable outcomes that draws on the assessment of the jail population and community capacity. Number 5, implement research-based approaches that advance the plan and ensure that working groups or individuals with assignments feel supported but also accountable to the leadership team. And 6th, track progress using data and information systems and report on the successes. NACO and the CSG Justice Center will work with initiative partners to integrate and maximize their existing resources to assist counties, as well as coordinate outreach to media and demonstrate a groundswell to both policymakers and practitioners. There are many, many national partners in this. The second key component is technical assistance. This will be to counties and policymakers at all levels of government that facilitates call to action planning and implementation efforts to reduce the number of people with mental illnesses and co-occurring substance use disorders in jails. NACO and the CSG Justice Center will work with partners to provide an online toolkit keyed to the 6 actions, distance learning opportunities, peer-to-peer exchanges, and for a limited number of counties, more in-depth technical assistance. There will be a self-assessment checklist to ensure that assistance is aligned with how much progress a county has already made, and a planning template to help county teams develop data-driven strategies that are tailored to local needs. The third key component, a national summit of teams of county leaders and stakeholders to advance implementation plans. In partnership with the American Psychiatric Foundation, a summit will be convened that includes teams from counties that have well-developed prevalence reduction plans and meet objective criteria for participation. Team members will be high-level stakeholders from multiple systems and will represent counties of various sizes and geographic locations. The summit will help counties advance their plans, measure progress, and foster a core group poised to lead others in their states and regions. People with mental illnesses and their advocates will be engaged, as will state officials and subject matter experts. Although much of the initiative focuses on county efforts, states will be engaged in the partnership at every step to ensure that their legislative mandates, policies, and resource allocation decisions do not create barriers to lowering the number of people with mental illness in jail. The initiative will align state and local efforts and include activities that state officials and other stakeholders can engage in to complement counties' work. Additional activities will be explored as the initiative progresses that focus on the replication of lessons learned, developing and supporting leaders, and expanding learning communities. And just a little footnote here, I was at the Governor's Behavioral Health Advisory Council last week, and we spoke about this briefly, and there are counties across the state who are already getting engaged in this. In fact, Cottington County's commission passed a resolution this morning stating their interest in participating in the Stepping Up initiative. So it's moving across the state already. Okay, what about here? You know, it all comes down to where the rubber meets the road. And the next part could not have been done without the help of Liz Moeller and Jessica Snedeker at the jail. In fact, I'm just going to read their email because they spoke so well. Here are some of the numbers that you had asked for. I just want to stress that these numbers are a very rough estimate of the mentally ill population in jail. These numbers only reflect the individuals that we have identified as with serious mental illness. These numbers do not include general depression, anxiety, or substance abuse. And this just leads me to thinking the whole data collection piece will be very helpful here. We have identified 24 individuals in custody who are considered to be seriously mentally ill and under the care of the mental health department. Of those 24 individuals, 3 of them are currently in out-of-custody care. Another 4 of them were in out-of-custody care at some point. Of those 24 individuals, at least 5 of them may have a substance-induced mental health disorder versus an organic mental health disorder. Although there is no way for us to know 100%, we believe that 8 of the 24 individuals are here as a direct result of charges related to their mental health disorder. That was important for me to know is, you know, are they getting in trouble because of their mental illness, or was that an aside? So about a third of those are there because of their mental health disorder. The 24 individuals identified make up approximately 6% of the jail population. This does not include individuals housed at the CCC or all of the individuals that are out of custody. This percentage varies from day to day, depending on the number of individuals housed at the time. And it would have been very cumbersome for them to try and get like a year's worth of data, so they just took this like 1 day in time numbers. We have also identified 2 individuals that do not meet the criteria for serious mental illness, but are cognitively low functioning. There are also 4 individuals that are currently under mental health care, but their symptoms and actions seem to be more behavioral in nature. The top 3 diagnoses we see, which seem to cause legal trouble, are bipolar disorder, the schizophrenia spectrum disorders, and substance abuse. Unfortunately, there is no way of knowing the exact numbers without conducting interviews with every individual that is in jail custody. I hope these numbers help. Please let me know if you have any other questions. Liz Moeller. Does anyone have any questions? I have to say, I am not much more into this initiative than you are right now because it's just been rolled out. I think I've been on just 1 conference call. I think some of the county people have been on others also with their NACO organization, but I'm happy to answer anything I can.
Any questions for Phyllis? Commissioner Kelly?
Is there costs assigned or along with this program?
You know, I would say not. From going on the work we did with the mobile crisis team, bringing the stakeholders together, they all volunteered their time. Implementing these initiatives, I think as we go along, we'll find actually reductions in costs. You know, if you're not spending a lot more money on people with mental illness in jail, and they're staying in the community. That will save the county money. I would say check with your NACO organization, because they would probably know that better than I, but my wish is that this will save money, not cost money.
I will tell the council and the city and the county commissioners that Gene Bender and I, Commissioner Bender and I are going to the National NACO Conference in July. And I would also suggest that this is something that we maybe talk about when we have our joint meeting between Lincoln County and the city and the county, which is coming up the end of July. And actually, Commissioner Bender and I will be back from convention at that time. This is a topic that I have seen before and was hoping maybe, and I haven't looked to see if it's anything that they're going to be offering at convention. We'd have maybe a little more information, and I think it's a good place for us because we'll all be coming together at that time anyway to discuss what we want to do as a next project collectively. Not trying to steal your questions from Phyllis if you have more questions, but to put that out there that that's a thought. Councilman King.
I have a question. You were saying right now about 8 of the 24 individuals that you were talking about being seriously ill. Mm-hmm. What other options right now do we have as a county, as a city, privately?
That would be part of this whole gathering all the stakeholders together to find out what the options are. My personal point of view would be the impact program with Southeastern. But there may be a lot of other options out there that I'm not aware of, and that's where bringing the stakeholders together to say, well, Carol, you were on the other one, and she had this wonderful graph of all of the things everybody did, and, you know, so we came together and said, well, this agency does this, and this agency does that, and who's, you know, so everyone kind of had an idea of who did what. And I would see us probably doing that same kind of activity again.
And then, if I may, you said that to really get an idea of the actual percentage of the population that is having these issues, that you would need to interview each one?
That's what Jessica and Liz said. I just read the email from the people at the jail.
Have you looked into that? Is there any standard interviews that...
There are some standard questionnaires, screening instruments that can be used, you know, in the jail population as people come in. I just found some searching the internet. There may be some that are better than that, but there are screening questions that you can ask.
Thank you.
Any other questions?
Chair.
Commissioner Barth?
You know, one of the things we've been discussing in our budget hearings in the county, it's a little known fact that defendants awaiting trial sometimes need psych evaluations.
Yes.
Because obviously that can bear on their responsibility in a crime. Well, we have people right now in our jail who cannot get a psych evaluation until September.
Yeah.
Until September. Let's just say that for a moment, maybe there is something wrong where they're under some psychological stress. Being in jail, is that the best thing for them? Costing the county $80 a day, is that the best thing for them? And I know that when it comes to psychosexual evaluations, the wait is even longer. Now, some of these things we can hire local people to help for like $950 a piece, but in the meantime, we have people sitting in jail waiting for this evaluation. Their trial can't even begin until this happens, and it's costing our community tens of thousands.
I had a little, you know, off-the-record conversation about that when we were in Pierre also, and it seems like some of our, like, state laws maybe need to be tweaked so that we can have like a nurse practitioner or a physician assistant with X number of years of psych training, or a doctor level psychologist to be able to do them. Right now it's very narrow as to who is allowed to do those, and we have a terrible workforce shortage in our state. We don't have enough psychiatrists and psychologists, and so, you know, I'm sure that probably plays into it a bit as, you know, supply and demand.
Any other questions for Phyllis? Is there a general consensus that we would take this up in our July meeting for at least discussion? Maybe we'll have a little more information at that point. So thank you, Phyllis, for your presentation.
I just have one more thing. I don't come unless I do a commercial. November 7th, Dancing with the Sioux Falls Stars at the district. You will be hearing more about it. We now have our 6 local celebrities lined up, and we'll be putting those out in the media, but mark your calendars to come for the most fun, wonderful evening of the year.
Thank you, Phyllis.
Shameless promotion. Also, I have a handout that I could leave with everyone that kind of highlights what I said.
I think that's the one.
Oh,
we
okay.
have. Yep,
All
we
right.
all have a copy.
Okay, sounds good. And then maybe, Cindy, I can leave this. This is a little older, but Eli Lilly put it out, and it basically says the same thing, so it's been going on for a long time.
Okay.
All
You
right.
want to just give them to Bob, and he can
Okay, I will do
make
that.
sure we get them.
Thank you so much. And, I'm happy to help, and I know Wendy is happy to help any way we can.
Okay, thank you.
Item 2 is Homeless Advisory Board 2025 Plan by Stacy Teason, Coordinator for the Homeless Advisory Board.
Good afternoon, Stacy.
Good afternoon. I'm excited to be here. My name is Stacey Teason. I'm the coordinator for the Homeless Advisory Board, and I thank you for your time, commissioners and councilors. And you are getting the first unveiling of our 2025 plan. We've spent the last, I'd say, 5 months trying to put this together and make it make sense, make it be logical, and then also have some key pieces to it so that there's actually a plan that people can put their arms around and say, this is what we're doing, and show that we're making progress on things. So my plan is to just kind of go through that and outline those with you, and then talk a little bit about why we need a new plan. So with that, the original plan was created, finalized in May of 2005. And it had specific pieces. There are about 20 different elements into that plan. So I'm just going to go over a few of the ones that we think are the most relevant and actually ones that we made some significant progress on. And the first one, of course, would be the creation of the Homeless Advisory Board. But then after that, a joint city-county building, which is the Health and Human Services building on 4th and Main. So you see that. That is where the health department is for the city and also where the county human services office is, so that we've got kind of a combined effort of work going on. We also know that one of the key areas that we were tasked with was our chronically homeless population. We heard time and time again that about 10% of our homeless population were actually taking up about 80% of our homeless resources. So with that, we did a business plan, we did a lot of research, we went to a couple different site locations, and the Safe Home building on 3rd and Minnesota that you see right now is an end result of that. It was designed to be permanent supportive housing, and it's called Housing First, which basically means that we're taking you where you're at. We recognize that you have a substance abuse issue and that you've been homeless. But the bigger issue is that because of your substance abuse, you are constantly cycling through the system. So you are repeatedly going to jail, going to detox, ending up in the ER, and costing the taxpayers lots and lots of money. So the result then instead was providing permanent supportive housing units that are staffed 24 hours a day. Case management services are provided, and it's been amazingly successful. Obviously, we do local surveys. We talk a little bit about our homeless numbers and how we track that, and we'll show you what that looks like. But every year we conduct general surveys, but we also kind of keep track of what's going on an overall basis. Part of my job is getting out and spreading the information and making sure that you are all aware of what's going on. And then obviously my biggest thing of excitement is the Bishop Dudley Hospitality House. It just opened in January, and it was through the work of the Catholic Diocese and then many concerted efforts of the community to come forward and recognize that the work that the Salvation Army was doing for the last 6 years wasn't enough. They averaged about 81 individuals per night on the last night of their last winter of operation, and so we took all of the information that we had from the Salvation Army and we put that into a plan for the new facility. And basically came up with the fact that we needed about 80 beds in the men's side, 20 beds in the female side, and then we could use as many family beds as we could get. Based on the space limitations, the most that they could fit in there for us was 7 family units. So pretty proud of that. It is working fabulously well. The Good Shepherd Center moved into that facility as well, so we call it a new connection center. So people are coming through on a daily basis, getting help with showers, food, their laundry, the things that they need. So these are some of the key pieces. There's more that we've done, but this is just some of the big highlights. So we talk a little bit about why Why do we need a new plan? Well, I'd like to explain to you a little bit about what our numbers look like right now in Sioux Falls and explain to you that ending homelessness isn't really maybe where we're at because it's a challenging thing, but we look at how we can put a safety net around people who might be stumbling, who might be facing an eviction, and come forward with them to keep them housed or get them housed as quickly as possible. So we wanted to make sure that that was outlined in a new plan. So here we go. And I know it's a lot of data, so I will give it to you as best I can, but keeping in mind that these are all people's lives that we're counting. So every year we do an annual count, and it is as good as we can do it. It's 24 hours. We go out at 3 a.m. and we finish up at about 10 p.m. We go all the places that we know. The police go with us. We travel about. But this is really only as good as the volunteers, as good as the weather is, because now we have to do it in January, so it's a little bit more daunting than it was in September. And I think you can see the reflection on that. The number from 2013 was actually still a September number, so 618. The number for 2015 was 463. Reflecting the weather, reflecting maybe perhaps progress. We can be excited about that a little bit, but it really is only a one-day count. And so when you look at that, 126 children were identified that same day. So a 24-hour period, we came across 463 individuals. In regards to the Bishop Dudley Hospitality House, it's been open about 6 months. So far, they have served 652 unduplicated men. So when you go back to our count that I just showed you, 463 in one day, over a 6-month period, we've counted 1,008 unduplicated homeless individuals. 47 families, which comprise 167 individuals, or of course the number that I always think is frightening, 101 children, and then 189 women. So I think that is a lot more than any of us were anticipating. There's been many nights where they've been to capacity, and we weren't expecting that either, especially since it's warmer out now. So it does cause a little bit of concern for what the winter months might look like. So we're going to be addressing that as we move forward. But just an overall understanding that 1,008 unduplicated homeless people have come through the doors of the Bishop Dudley since it's opened. The school district numbers are my favorite data simply because they're the longest. Oops. Oh, wait, I'm not there, I'm there. Okay, this is the new data system for the county, and so I like this information as well because we never used to have this information, but this is the number of households that come through the county requesting assistance with either rent, deposit, maybe a utility disconnect. But in regards to this, we're looking at households that have come in from January to June. 890 households have come through the County Human Service Office requesting assistance. They're homeless, identifying themselves as homeless, 890 different households. There's the school district data. So this one is from the beginning of the school year to the end of the school year, so August to May. And this is faculty members, families, whoever identifying a child as homeless, self-reporting. 923 children were identified. This number is non-duplicated, so if they were homeless in August and they end up homeless again in January, they're only in that mix one time. It's cumulative from August to May, just like I said. And so the numbers on that aren't on this chart is that this is reflective of 469 families. 376 of those youth live doubled up with other family, friends, perhaps strangers. 199 in motels, 132 in transitional housing programs like Heartland House, 131 in places like Children's Inn, 57 in shelters, and then 28 who were completely unsheltered, living in tents, living in their cars, living outdoors somewhere. And for that number to be, that's a pretty high number. And then the number that I think is also frightening is that 39 youth who are on their own were identified. So they have no one. They're kind of couch surfing. They're out there on their own, but they're still going to school because obviously they were identified by somebody. This number is it's very small because people don't self-identify in high school. They don't like anyone to know that they're actually experiencing homelessness. This chart I know has been around a bit, but I got the latest and greatest data just yesterday. So the May numbers show that we actually bridged that 50% for elementary students. We're at 50.3% of our elementary students at the school in the Sioux Falls School District that are on free or reduced meals. And I wrote that number down, so I wanted you all to know. I mean, it seems like it could be pretty high. Reduced meals start at 185% of poverty, so a family of 4 would be earning around $44,000 a year. Free meals are at 130% of poverty, or $31,525 for a family of 4. For all of our kids that are identified as homeless, they automatically qualify for free meals. So just you see 44.7% of our students then overall are receiving free or reduced meals in the Sioux Falls School District. Yeah. Which for the reduced prices and stuff? Okay, yeah. Reduced prices begin at 185% of poverty. So just in general, the federal poverty guideline for a family of 4 is $24,250. That's just the magic number. That's the number that the county uses in regards to how they determine financial assistance. So reduced prices are at 185%, or $44,863 annually for a family of 4. Free meals start at 130% of poverty and are $31,525 for a family of 4. $31,525. And I can certainly email you this too. Okay. And then this one too, the Housing Choice Voucher Waitlist, people call it Section 8, that's its old name. This is that magic thing where we talk about how many households are in need of housing and how many are waiting. This number's decreased substantially over the last 3 months because they've been able to issue some, but overall we're still looking at 3,116 households that are in immediate need for housing assistance. This is by far the best program that we know to reduce homelessness, to prevent homelessness, because this is based on your income. So a person who's earning 0 will pay 0 for rent. So if they have some situation that comes up and they end up unemployed or some sort of situation, medical, whatever, the rent will be reflective of that. They never would pay more than 30% of what they're earning. And if you look at this number, you'll see that the largest need is in 1-bedroom units, but also in 3-bedroom households. And the bigger need is for people earning less than 30% of our area median income. Our area median income for a family of 4 is $71,000. So 30% of that, or about $24,000. Our vacancy rates remain really low. We're at about a 4.67% vacancy rate for apartment units in this community. Why is that a problem? It's a problem because people who have vouchers can't find a place to rent. Landlords that are available can be very selective, and they also are charging more than what the voucher can cover. So if someone's getting a voucher, it's taking them an extraordinarily long time to be able to get housed. So we have a solution, we have a problem, but the solution is not necessarily fitting the problem. So that's my data. Is there any more questions in regards to just the overall numbers? I know it's a lot of information, but it's really what's going on in the community. It's latest and greatest as of last Friday, so I put this all together. So now, to show you why, here's the plan. This just really builds on the original plan, which, like I said, was created in 2005. And we made sure it incorporated all the relevant pieces for social providers, government, that sort of thing from Sioux Falls Tomorrow. And we wanted to make sure that it was something that could be tackled and not too crazy big. So we only went with 5 areas. And so those are board infrastructure and governance, information management, housing, supportive housing and services, which we'll see are different because we need to make sure that once we get people housed, that if they have challenges or difficulties, that they can stay housed. And then public policy and community awareness, utilizing such things as Facebook and Twitter to kind of keep people apprised of things that are going on out there. I took this quote from the federal government. They just reissued an update to their 2010 plan. So they're halfway through, and they haven't ended homelessness either. Surprisingly, the federal government hasn't ended it either. And they said, an end to homelessness does not mean that no one will ever experience a housing crisis again. Changing economic realities, the unpredictability of life, and unsafe or unwelcoming family environments may create situations where individuals, families, or youth could experience or be at risk of homelessness. An end to homelessness means that every community will have a systematic response in place that ensures homelessness is prevented whenever possible or is otherwise a rare, brief, and non-recurring experience. I love that. That's what we would strive for. That's what we would want to see. If you end up homeless, we want you caught. We want to make sure that you can get housed again as quickly as possible. So here we go. Goal 1, board infrastructure and governance. And the goal is to develop an infrastructure that strengthens and enhances HAB's mission, philosophy, and guiding principles. We created a new mission statement to go with that, and it's in your 2025 plan, but basically we're looking at finding ways to prevent and end homelessness in our community. The things that I think on this, all of them are important, otherwise they wouldn't be included in the document, but I am respectful of your time and recognizing that you can also see this for yourself. So some of the things that we really need to do, of course, are quantify supply versus demand on affordable housing, shelter, and supportive services. Do we have what we need? Do we need more? And if we do need more, how are we going to get it? Who's got the funding? Gaps in service areas. I think Phyllis just showed you exactly what we're talking about in gaps in service areas and efforts driven to eliminate as necessary. We really just need to make sure we're using the best use of our dollars. So if we have funding available, we're working collaboratively, we're not duplicating services. And as a board, that will be something that we would strive to make sure is happening. Because ultimately, the work that's being done is only as good as the oversight, and so that would be the role that the Homeless Advisory Board would take on in regards to those things. Goal 2 is my favorite because I've been talking about this for as long as I've been breathing, I swear. Information management. How do we know what's really going on out there? You just saw a whole lot of information that had different data. So do we have 463 homeless people? Do we have 1,000 homeless different people? How do we know, and how do we know that what we're doing is actually having any impact? So with the exciting news of receiving a Bush Foundation grant through the 211, we are hopefully going to be implementing a coordinated assessment and database system. This, of course, will require some serious involvement from the community, and they will have to come forward and be willing to do this. We've been talking about this for a long time, and the barriers always come up. So as this moves forward, we're going to have to address those and work to facilitate it as quickly as possible. But ultimately, what we want is to secure funding in a database that makes sure that all of our service providers can actually put information in there and get information out of there. And you can lock down what you need to so that if it's somebody's personal information about their treatment or something like that, it stays only with the agency that they're working with. But overall, there's information available to anyone who needs it to be able to identify how many are coming through. Like if you take, for example, right now, St. Francis House and Heartland House are both transitional housing programs for families. I don't have any idea if the 30 families that are on the Heartland House wait list are the same 20 families that are on the St. Francis House wait list. You would like to think that that's true. I mean, you would hope that they're referring to each other, but I don't know for sure because we don't track that information on a consistent database. So something like that. And the state has its own system, a homeless management information system that they've been trying to get everyone involved in for quite some time. It's a difficult program, and it hasn't gotten a lot of buy-in, and the only ones that are currently using it are those who receive federal dollars for their homeless program, so they have to. And that might be something that we look at as we move forward, some sort of carrot stick. We want you to do this. We need you to do this. So information management to me is the key to how we're actually going to address what's going on in our community because we have to have accurate data. Housing is big. We don't have enough. We need more. You hear it from conventional rates. I hear that you need 500 new units a year just to keep up with conventional rate demand. I heard that there's a need for 122 new units downtown that we could supply. And then I'm out here saying we need 250 new affordable housing units every year. And we're talking about that 30 to 50% area median income family or individual. So again, a different metric. So we have to talk a little bit about what exactly do we mean when we're talking about affordable, because I think it kind of depends on which conversation you're having. But what we want to tackle is that 1,600 new units of affordable housing in the next 10 years. We think it's something that we can do, and we're going to work together with developers and other community and state and federal agencies to try and figure out how to develop that funding, that layering of dollars to see if that's possible, and then really knowing how many units we actually need at 30%, 40%. And we only started building units at about 30% of AMI in 2012. So we're a far cry from where we need to be, and ultimately it's a huge gap that people are experiencing, and they're ending up doubled up or in the shelters at Sioux because they have no places to go. And then when we talk about those supportive services, we're really talking about people who are experiencing mental health. We're talking about people who have generational poverty issues. We're not talking about someone maybe who just had a job loss or had a broken arm and weren't able to work for a little bit, but we're talking about our families that are very challenging, that have learned how to survive, and they're kind of stuck in that survival mode. We want to provide services to them, some case management, whatever you want to call the correct phrase, but to be able to make sure that they can stand on their own 2 feet once we get them housed. And the county is helping do that right now with the families at the Bishop Dudley Hospitality House. So that's an amazing program, and it's showing some solid success. I'd like to see that get implemented further. Goal 4 is focused on supportive housing and services. We talk about developing a community of stakeholders that value tenancy preservation and work collectively to prevent homelessness. Tenancy preservation is a fancy phrase I learned a couple years ago, and basically what we're trying to do is keep you from getting evicted. It's pretty simple. There's tenancy preservation courts. Boston has taken this on as a monumental task to try and keep their homeless populations down. And then working collectively to prevent homelessness basically means that we all are in it together. And how are we gonna make everyone interested in doing this? And I think one of the big ones is working with our landlords. We have a lot of issues right now. I just got an email this morning from the person who works the DUI courts. They can't get their people housed. How do we find more landlords willing to work with people with challenging backgrounds? Where do we get rental units that they can afford? Because we're talking about people who have to take any job because they have to get a job as part of their court order. So they're taking minimum wage jobs. We've had this conversation before as well, but in order to be able to afford an apartment in Sioux Falls, you're somewhere around $10.50 to $12.50 an hour, depending. So $8.50 an hour is not cutting it for a single person to find an apartment to rent. And that means basically you're looking at an apartment that's about $442 a month. We aren't building those. We don't have very many of those. And the ones that we do have probably are a little bit challenging. So really working to prevent evictions is the best option that we have. And so we'll focus a little bit or a lot of energy on tenancy preservation. And then goal 5, public policy and awareness. Just making sure that people understand that this problem really does exist, that there are solutions, that our homeless populations are people. They're experiencing they're experiencing difficulties. Some of them have substance abuse issues. Definitely some of them have mental health issues. We talk about that. Typically we say 1 in 4 people are experiencing a mental health issue. So just making sure that we recognize that not one mold is going to work for every single homeless person out there. And men have different needs than women in regards to what they're looking for. And if they have children, that's also, or if they're looking to get their children back because they're currently in state custody, also issues. And then, of course, part of this also goes with looking at ordinances. I'm not keeping up with my clicker. Just looking at local ordinances and how they're impacting our community in regards to criminalizing or not exacerbating homeless issues. So something that I feel very strongly about. So those are the 5 goals. They have a lot of pieces to them, and these are just the goals and objectives. There's activities that go with it, and the dates on the side kind of show where we're thinking that it will take, how much time it will take us to accomplish those. So from that, then we have created action teams. So each one of the board members is going to go forward and have signed themselves up to be on one of those strategic areas, knowing full well that it's going to be a lot of work. And I think it'll be a lot of fun, too, because we're going to try some new things. And this is an audacious time for us. We're launching a whole new plan to try and show that we are serious about our community and that we can do this. I mean, we're not Los Angeles. We don't have 80,000 homeless individuals. We have about 1,000, basically, on any given survey. So how do we help? What do we do? And this plan, I hope, is going to outline for us and show us how to tackle that. So those action teams, I will welcome any one of you to join those action teams. Each goal and each objective have specific timelines. We're hoping to make them be monthly meetings. And as we tackle them and things get underway, those meetings will reduce in the amount of time that we need to have them. And maybe they'll change. Maybe there'll be subcommittees that come from that because the pieces will be different and people's expertise will be a little bit different in the areas we need them to. So I'm just very excited to bring this forward to you. It's been a lot of effort. I think we've got a lot of work to do. I've got a lot of work to do. I hope that I have your support in trying to address this issue. The numbers are real. I don't need it. I don't need to inflate anything for you to try and make you have shock value. This is really what it looks like in Sioux Falls. And so I welcome questions, and thank you for your time.
Councilman Staggers.
First of all, Stacy, can you tell us how much your budget is And I assume it's all with the county?
I don't have a budget. The Homeless Advisory Board was just created as a joint city initiative in 2005. So anything that we do is through the work of other agencies. The county does what it does in regards to the financial assistance through the Human Services Department. But ultimately, different departments of the city, like the Community Development Office, has a Bright Futures program that they operate through ICAP. I specifically have no operating dollars to do anything. I just go forward and talk to individuals and hope that they think that this is a really good idea that they should put money into.
So, if I can be a little bit personal,
Yeah.
Where do you get your paycheck from then?
City and county. My budget is half from Darren from the Community Development Office and then half from the Human Services Office. So that's the dollar commitment in regards to the work that I do. So salary and then miscellaneous office and that sort of thing.
Yes. Also, one thing here, I'm a little concerned about 2019 as the deadline for examining local ordinances. It would seem to me it would be good to move that up even sooner.
Okay.
We don't want to criminalize people and unnecessarily. And yeah, I would like to volunteer for that particular committee. Yes.
Yay, thank you.
Are there any other questions for Stacy? Commissioner Councilman Erkenbach.
Thank you. Thank you, Stacy. It's a pretty comprehensive plan, and a couple of us are already on the Homeless Advisory Board, and so we've been involved with this over the last several weeks and months. But Stacy's done the bulk of the work. I just, in addition to recognizing that, I guess, would you remind this group who the Homeless Advisory Board is? We remember that it was created 10 years ago, and it is an advisory board, but it is not elected officials necessarily. It's quite a mix of people. Could you remind us who they are?
Yep.
Just in general, doesn't have to be named.
It's created by a joint resolution between the city and the county, and it's got basic requirements, and then it has some additional community members. So it requires the city council, the county commissioners. So I have Michelle Erpenbach, I have Jeff Barth. It requires the director of the County Human Services Office, so Carol Mueller. It requires the director of the Community Development Office, so Darren Smith. It requires the director of the Health Department, so I have Jill Franken. Then I think those are my primaries. It requires a member of the school district, so we have Tracy Jensen from the school district, from the Homeless Education Office. And then I think those are all the requirements. And so then we have Tom Wingert from Woolman Insurance. We have Jeff Nelson from Keller William Realty. Jim Meyer from Target Retail Credit Cards. And am I forgetting?
Joan Franken.
I think, is that everybody?
Joan from Costello.
Oh, Joan Franken from Costello, my housing guru. So she will help me through my pressure to build more affordable housing units. So those are my board members, and I'm grateful for their time and their guidance. So
if I might, Madam Chair, just a couple more thoughts. One, you just told Councilor Staggers that you're basically an unfunded mandate because we just pay your salary to kind of control this. Yeah. You know, you heard a lot of cats in your life, and I understand that. So talk then about the Bush Foundation grant and what that means. I mean, you touched on it just a little bit. It's a huge project, though. Why is that data important to us as a community?
A group of us were meeting for a couple of months before we had a wild hair idea and thought to apply for a Bush Foundation grant. But we do not have any type of centralized database for our homeless population. We have no idea if you come into the County Human Services Office, if you went over to Community Outreach, if you went over to Salvation Army, if you're getting your rent paid every single month of the year and you're just saying you have an issue. That, of course, is what everyone's always concerned about, is there fraud. That's not what my concern is. My concern is, what's the next chapter? Are you staying housed? Are you getting your family's needs met? And then if so, are you moving forward to become employed, or are you being able to take care of your family and your situation? So what we decided we needed was something that the federal government has been pushing for several years. It's called coordinated assessment. There's one in, and they all funnel through. And so the 211 seemed like a logical location for that, because obviously they're 24 hours a day. It's an easy number to remember. They already operate a comprehensive database with resources. So Janet was willing to go ahead and apply for this Bush Foundation grant, and we were informed in May that we received it. We have 25 months to put together, and $200,000, which is pretty awesome, $200,000 to make this a reality. It's not sustainable dollars, so it's an initial community innovation grant designed to make us think bigger, think better. So it's really mind-boggling to think of all the pieces. Right now we're looking at hiring a facilitator as part of our grant. We had said we were going to hire a facilitator that would bring us together as a community and say, there are barriers, but there's amazing things that we can do with this data. How do we get you all on board to do that? And then from that, selecting a database provider, figuring out all the pieces that could go into it, who needs to be involved. I mean, at this point, we're going to go very, very small and look at just trying to get our housing people on board. So any of the agencies in the community that provide housing, we'll be knocking on their door to ask them if they want to be a part of this. As it gets bigger, I know Matt Gasson from Feeding South Dakota has been really excited about this, and I go hand in hand with him in talking about housing insecurity, food shortage. If you can't afford to pay your rent or all your money is going on your rent, you're going to need assistance with food. If we can show that, I think that that speaks volumes to what's really going on in the community. So this data is not data, it's people's lives, but it will be all in the same methodology. There's different providers. We haven't really even gone down the road of who we would pick. But ultimately, the end goal is that all of the providers are going to be entering their data into this same system, and then you can pull that family up and say, John Smith was at Bishop Dudley House on June 1st through June 30th. Then we know he got housed because it tells us that. He was discharged to an apartment. And then if he happens to come back in, we can go right back into that same file and say, John Smith lost his apartment in January because of blah, blah, blah. And then we would know, and we can keep track of that. So we know if we're talking about duplicated versus unduplicated, and really what the barriers are, because we don't know. I mean, if you get unhoused, was it because of it was too expensive, you lost your job, what's the situation? We don't know. We don't know the rest of the story. And that's how we kind of sold it to Bush. We said, we really don't know the next chapter. We know that you had an emergency. We know that some service provider stepped in and helped you, and you don't know anything more beyond that because that's the end of the data. So really we're talking about how do we keep consistency and have all of the agencies providing some level of same data.
Good, thank you.
Any additional questions for Stacy?
Madam Chair?
Commissioner Barth?
I just want to comment that I think that we've taken care of the low-hanging fruit over the last 10 years, and so it's going to get more tough. Certainly just finding a place to keep people warm in the winter, you know, we would get to September and what are we going to do? And the Salvation Army several times stepped up, and now we've got the Bishop Dudley House. But things are going to get more difficult. The issues with statistics, you know, the way that things are measured can be changed by one agency or another. And we have a lot of work to do, but I think we've made great progress, and certainly appreciate the work that Stacy has done.
Thank you.
Councilor Jameson.
Thank you. I wanted to say as well, I don't know a better way to say it, but bless you, Stacy, for the caring and what you do. I mean, it's beyond me. And I participated once in your survey of, you know, going and counting individuals, and the relationship you have with those individuals and staff and the police department, I mean, it's really admirable, and you do a great job, and bless you for doing it.
Thank you.
But when you talk about the tracking of these individuals, will you actually have their names?
Mm-hmm. For the homeless count data that we do in January, no, because that's just simply a survey and it's designed to be anonymous so that people will talk to us. But this database will actually have everybody's information. What you can decide what will be available. So like as a service provider, your case management notes can go or not go. People's social security, people's birthdays, all that stuff that's dangerous to be out floating around will all be locked down. Because right now the problem is you can go to every agency and you have to do an intake. You have to do a form. You waste 20 minutes to an hour doing paperwork at every agency that you go to. If we do this, then we're freeing up caseworker time, we're freeing up your personal time so that you don't have to come and tell your story over and over and over again, especially for our victims of domestic violence, people who are recently experiencing homelessness because of a tragedy, to have to tell over and over again how horrible your life is right now. I wouldn't want to do it. I can't imagine forcing anyone else to do it. So that's kind of the plan. And if we set it up simple, in my head, it works like this. You call the 211, and they have 5 basic questions. And they say, what's your name, what's your emergency, or what's your situation? And then kind of a little more, do you have children with you? And then we say, because we'll have active live data, you can say, yes, there's an opening at the Bishop Dudley Hospitality House, go there. Then you email Bishop Dudley Hospitality House, they're expecting you, so you get greeted with it's a warm handoff, basically. I called, I had an emergency, now I'm going here. Maybe it's St. Francis House, maybe it's Union Gospel Mission. Whoever wants to be in the mix gets to be a part of this, and it's a long ways. I mean, we're 2 years out from even hoping that maybe this jumps on, but it's something we've talked about for a long time, and to me, it's the best way. Minneapolis just kicked it off last January, their coordinated assessment system. So that's the model that we're kind of looking at. We've actually talked to them. Tampa Bay has something that they have there. It's called their network. They do it already. They have over 20 providers. They've been doing it for about 10 years. It's worked phenomenally well for them to keep track of people who are constantly flying through the system, and then people who have only needed help one time or maybe once or twice in their lifetime. And that's really kind of where we're talking about. We handled our chronically homeless individuals, and they're still out there and they still have their issues. We don't have a handle at all on our chronically homeless families. I don't know, we know them by name, we know them by anecdotes, but we don't have a good way to, maybe we need to put them in a type of safe home program where they're getting that type of intense supportive services 24 hours a day, or maybe not. But we need to be able to better track who they are, where they are. The school district doesn't have the ability to share information because they're protected by FERPA, but if there's a way that we can work together and get that information on whichever way we can do it, then that's how we would want to do it as well, and that will, of course, kind of be up a little bit to the new superintendent. But when you talk 923 homeless students, are those the same 923 kids that came through the county? I don't know. Everyone's supposed to make referrals, but if we have some sort of automated system that I just send an email and it flies right over to you, and now you know that Jim and Bob and Susie and 6 other children are on their way, you know, and then that referral can go right on off to the school district as well. So they're all in one big mass email saying, this is what we've got, here they go, in an attempt to provide better services in a more efficient route.
If I could, one other last observation I had when I was out with you was there were guys who kind of liked living on the edge and wanted to be in that environment, and others absolutely who did not want to be there, and you know it was unfortunate. But there were others obviously who wanted to live that way on the cheap, I would call it. And will you be able to separate those people as far as a number? So there's a group of people who are just.
You can even do that now just based on the data that the new Bishop Dudley Center is just in general tracking in regards to their unduplicated numbers. There's been some guys that have been there since it opened. And so then that gets back to a different issue in programming and expectations, but it was initially designed to be a warming site, so we didn't want anyone to freeze to death. So then from January to April, it's kind of a safe place to go, and it doesn't have expectations on you other than that you be nice. Once it warms up, then those programs need to change a little bit, and we need to help you decide whether that's what your plan is. And if that is your plan, then maybe this isn't the place for you, because we want people to be moving forward. Maybe you are outdoors. I mean, in the summertime, it is what it is. You can come back through the connection center piece where you can take a shower and get fed, but ultimately everyone should have expectations of themselves. And if substance abuse is your issue, I mean, and we get back to our safe home guys, sometimes that substance abuse is the be-all and end-all. And so then we have the program there designed to help the chronically homeless individuals. And they don't all pass. They don't all do well there, and they end up being evicted. But harm reduction is all we can ask.
Well, I just think the getting around that data is probably, you're right, the biggest thing you've got to go do, and I'm glad you're on that, because I think from there, then those other approaches can be identified and solutions found. So,
well, I think it's a great opportunity for agencies to be able to come forward, because we have a lot of output. I can show you numbers and numbers and numbers, but I can't show you outcomes. How successful was your program? So you had 180 families come through your program last year. How many of them are still housed? You don't know that. No one knows that. So being able to track that and show, I mean, I think about when you look at fundraisers and events that people go to and sponsor, if you can say, we had 180 families, and I know that for a fact 179 of them are here, 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 and here, wow, here, let me write you, let me give you another whatever. So that's kind of the whole point, is it helps agencies because it shows concrete proof that their program is effective. It helps families and individuals because they're being touched in all the right places in regards to service providers, the things that they need at the time that they need them, and we're not giving them more than they need. There's a lot of talk right now about toxic charity and enabling and people doing too much for people and not expecting enough of them, and this can kind of help that too.
Any additional questions?
Stacy, you're also involved with the county building north of the police department.
The Safe Home building?
Yeah, the safe, is that the
Yep,
safe house?
Home. Yep, Safe Home.
On that one, can you give us some figures on the person that stayed there the longest, or if you've seen any real results, or, I mean...
I don't actually have that. I mean, obviously there's that data available. It's been open in that facility for about 3 years now. Jeff is the program manager over there that would have that data. I would say it's been very impactful. There's 33 apartment units in there that they're called permanent supportive housing. People can stay there as long as they're complying with the program. And the ultimate goal there is to keep them out of the other places, to keep them out of detox, to keep them out of jail. It was never designed to keep them sober. It was never designed to cost less money. It was always designed to enhance quality of life and stop the repeat revolving door of detox and all of those things. Housing First is a well-proven model. Utah itself is saying that they have had a 72% reduction in the number of chronic homeless individuals in their community because of a safe home type program. So ultimately, it works. I don't have specific data right this minute that I could share with you, but I could get that.
Oh, okay.
Yeah, no, they track it. It's all tracked. I don't
Right,
personally work with it
that's-
day to day to know that data off the top of my head, but yeah.
Okay, thank you.
Yeah.
Any other questions? Commissioner Kelly.
Stacy, I disagree with you on one thing. You said that was never intended to save money. That was the way it was sold to the county commission, and as far as I know, it has. We've seen it through the detox and the emergency room, but that was one of the factors of opening that house, is not to provide those guys with TVs and everything else, but to try and get them on the right track.
Mm-hmm.
Additional questions or comments? I don't see any.
Thank you.
Very much for your report. Is there any new business? Any old business? I'd look
Motion
for
to
a motion
adjourn.
to adjourn from the county. Is there a second? Second. I have a motion and a second to adjourn from the county. All those in favor say aye.
Aye.
Those opposed, same sign. Motion passes unanimously.
Motion from the city.
Move to adjourn.
All in favor, say aye.
Aye.
Meeting adjourned.